is your question? Right, so if you have read and understood considering your surgical anatomy station, kindly please tell me which region are you looking at?
I'm looking to gluteal region,
Gluteal region, right.
posterior.
You can maybe, yes, behind. If you can read, it says superficial and deep. So that means there are two sets of muscles which form the
Yes.
bulk of our, gluteal region. So if you can identify these muscles which are in superficial region, which
It will
muscle
be
could this be?
gluteus maximus and medius.
All right, which one is this?
Medius, gluteus
Okay.
medius.
Right, if you can identify this muscle over here.
Gluteus minimus.
Okay, moving on to the deep muscles. If you can identify this muscle.
It will be the
This is minimus. Gluteal.
this is gluteus minimus, okay.
Yes. So if you can identify this muscle, please.
Piriformis.
Yes. And right, if you can identify this arrow over here, this muscle.
Quadratus femoris.
No. Gemellus superior. And then if you can identify this one.
Quadratus femoris.
Obturator internus and then obturator externus. Okay, which muscle is this?
Inferior gemelli.
No, that's quadratus femoris. Can you please tell me the origin and insertion of quadratus femoris muscle, please?
Okay, the origin, it will be from quadratus quadrate tubercle in the iliac crest, and the insertion, it will be in greater tuberosity of the femur.
No, you're telling me a picture. All right, what is the nerve supply of quadratus femoris?
What is?
The nerve supply, please.
The nerve supply, it will be the nerve to quadratus femoris, except short head, it will be for femoral nerve.
There are no short head of quadratus femoris. What is the action of quadratus femoris muscle?
Okay, it will be abduction and medial rotation.
Just the lateral rotation of the thigh. Okay, can you please tell me what are the muscles which supply the gluteus minimus and medius, and which which nerve supplies muscle gluteus maximus?
The gluteus medius and minimus superior gluteal nerve and maximus inferior gluteal nerve.
Okay, what happens when there is injury of superior gluteal nerve?
Okay, it will be a deformity on the other side. It will be Trendelenburg gate.
Yes.
And this is sag, the hip sag to the right side.
To good side, yes. So,
Good side.
yes, what does it signify? How would you interpret the results? Yes, the examination of Trendelenburg.
It will be a iatrogenic medical. It will be injury of maybe injection or during the operation. So this will be meaning effect, it will be on the other side, affected muscles on the other side of sagging sign.
If you can tell me in picture A over here on the left-hand side, which bone are you looking at?
This is femur.
Okay. Can you identify the structures which are circled red, please?
It will be head and neck,
Okay,
greater
two,
tuberosity,
six,
greater
please.
tuberosity,
6,
neck of femur,
4, please.
it's an intertubercle line,
9 or press. Okay, 5,
5 lesser tuberosity,
9, please.
9 it's shaft of femur,
Yes. Moving on to picture B. What is 3, please?
head of femur,
What is 1? You can see here.
fovea of femur.
11,
It's intertuberosity fossa.
5, please.
Lesser
What attaches here?
tuberosity, it will be the psoas muscle, iliopsoas muscle.
Right. Can you, moving on to the right-hand side, there are 3 images. Coming to picture C. What is 4, please?
Head of femur,
11,
neck,
8, please.
lesser tuberosity.
Okay. Can you tell me which bones form the hip joint?
Okay, it will be the iliac muscle with pubic muscle and ischial muscle. It will be form the acetabulum, and after this, with head of femur, it continues a joint.
What are the factors which stabilizes the hip joint?
Okay, all the muscle around the hip joint and the ligament. Besides, it confirm of head and acetabulum and make it more confirmed.
Yes, and acetabular labrum. And what are the names of the ligaments which strengthens the hip joint?
I don't know.
Iliofemoral, pubofemoral, and ischiofemoral ligaments. Okay. Can you tell me out of these 3 ligaments, why iliofemoral ligament is the strongest?
Iliofemoral, I don't know too.
Okay. When you're walking or climbing the stairs, so what are the
Yes.
muscles which are involved?
It will be iliotibial tract, including the tensor fascia, lata, and gluteus maximus.
Okay. When climbing up the stairs or the mountains, what are the group of muscles which are involved? Not just the gluteal region.
Okay, it will be, I don't know.
Okay. Right. Can you tell me how does the head of the femur gets its blood supply? From which vessel?
It has from retinacular blood supply and from circumflex artery. It has superior and medial and lateral circumflex around the neck, and this is make it liable for neck vascular necrosis if it's broken.
Yes. Right. How would you divide the fractures of the neck of the femur?
I don't know.
Because that depends on the management as well. And that really, really is important. Okay. Bell has gone, but all right. Can you please look at this and tell me what kind of image is this?
This is CT angiogram.
Okay, showing what, please?
Showing the femoral artery from external iliac artery.
Can you identify all the vessels or all the labels? 2
Okay.
or 3
Uh,
and yes, 6 and 7. What are these?
Okay, number 1 is external iliac, and the 2 it will be external iliac 2. 3, no, sorry, 2 is femoral, and 3 it will be profunda femoris. 7 superficial femoral artery. No, 6 is the profunda femoris, and 7 is superficial femoral. And 3 it's superior epigastric artery.
Can you identify these vessels? What kind of image is this first, please?
CT angiogram.
Lower limb, okay. Can you identify, right, if you can identify the vessels?
Okay, it will be
Here, which one is this?
popliteal artery.
Very good. Right, and this one?
This is anterior tibial.
No, anterior tibial is this one. This is anterior
Okay.
tibial. Okay, if you can identify this vessel.
Peroneal artery.
Yes. And which one is this?
This is posterior tibial.
Yes, good. Can you tell me the indications? When would you ask for this kind of imaging?
There are ischemia or DVT or any distal pulsation disappear, and any ischemia and any injury in the blood supply of lower limb.
This common pairing, okay. Right, okay, we'll discuss this with the femoral region. All right, good, thank you.